On Siksika Nation, the stories go back years.
We've heard allegations of people being targeted by hospital security and staff to be harassed and to be escorted off the premises. We've seen doctors just automatically assume intoxication.
Samuel Crowfoot says a new study published in the Canadian Medical Association Journal validates what community members have long experienced in emergency rooms: racism and discrimination. Researchers knew from examining millions of emergency room visits that First Nations status was associated with higher odds of leaving without receiving care. This study looked at why that was and came up with some disturbing answers.
I think any time we have a disparity that appears to be related to race or identity, it's important, because in an ideal system, we wouldn't have people having poorer outcomes based on who they are.
The researchers asked dozens of First Nations patients and healthcare providers to talk about the statistics. They shared stories of racism, stereotyping, longer waits for care, and communication and transportation barriers. Family doctor James McCocus says the whole healthcare system needs to change.
When these issues happen, when racism happens that causes harm and death, that there needs to be systems changed to address those things.
Alberta Health Services acknowledges there are barriers to care for Indigenous people and says it's implementing a roadmap to improve care for that population. But for Samuel Crowfoot, this problem is bigger than one province.
This is not a problem unique to Siksika. This is not a problem unique to Alberta, but it thrives here in Alberta.
He says patients and First Nations should complain and take cases to court to raise awareness and advocate for change. Madeline Cummings, CBC News, Edmonton.